the aquatic animal sector is just developing. It's a fledgling industry. But even with that, the contribution of this sector to the economy of the country is great. And it contributes in very many areas of food security, hunger alleviation, employment generation, and so on and so forth. And you have a lot of people that are involved in this, and we have a lot of resources committed to it. And with that, especially with the adoption of intensive bearing system for fish, which imposes stress on these animals, we have incessant incidents of diseases. Unfortunately, we don't have many trained hands to be able to handle diseases of fish. That's one. We don't have many facilities, health facilities that can handle diseases of fish. So, and when we are talking of climate change, we are talking of increases or decreases in temperature, flooding, and the rest of it. We rear fish in water.
Yes, sir.
And these are warm-blooded animals that their temperature depends on the environmental temperature. So a slight change in the temperature of the environment affects them,
Yes.
imposes stress on them, compromises their immunity. And of course, with increased temperature, you also have increase in the population of pathogens. You have these pathogens getting more resistant and the rest of it. And our farmers who do not have access to primary health care for fish when they have problems will go ahead and help themselves with medicaments that they are not supposed to actually handle. On a survey of the epidemiological survey of diseases of fish, pathogens of fish, in, I think around 2010, I was at a farm and I found a heap of the shell of antibiotics on the farm. The content has been emptied into a bucket, mixed with water, and sprayed on fish ponds without any recourse to good diagnosis, without any respect for antibiotic sensitivity, and without any respect for dosage anyway. So definitely you have a problem with antimicrobial resistance. And you cannot blame them, because I used to ask, if we have veterinary clinics in all the 774 local governments in this nation, there is no reason why we should not have aquatic health experts in all these places, so that people can have access. So, you have a misuse or overuse of antibiotics in the aquatic sector, aquatic animal sector. And of course, because people don't also respect withdrawal period. For example, for fish, if you use tetracycline or tetracycline, you will wait 21 days before you can sell that fish. Imagine a farmer who runs into a problem with the fish almost attaining market size, and he has been treating with antibiotics without any recourse. He will just go ahead and smoke this fish for you without observing the withdrawal period, and then sell it to you, and you are buying both the fish and residue of antibiotics. And of course, organisms that are already resistant to antibiotics may also be part of the deal. And these organisms have no, and their genes, they have no respect for any border, whether biological or geographical, or between animals and even humans. So it's a big problem. We have this problem in the aquatic sector, and it's always there. And we hope that we are able to overcome it. Thank you very much.